potassium, for example. So it's a first point of call. It's one of the first places the body decides, looks at the blood and says, is there too much sodium here? If so, can we deal with it in the urinary system? So if the body's having to get rid of a lot of excess sodium, then that may show up here as well. So we've got that bacterial imbalance aspect of UTIs and also the inflammation aspect of UTIs. So inflammation in itself is actually part of your natural healing response, either to injury, to trauma, to disease, to bacterial infection, to stagnation. It's a really important aspect of your immune system. It's your body saying, right, there's something not quite right here. Let's bring the emergency services in, which are things like clotting agents and healing nutrients. And then once resolved, the inflammation should calm down again. And you'll see from the pictures below, the emergency services are called, if you like, by histamines and prostaglandins. They're the substances that create inflammation in the area and send out the alarm for things to start happening. The capillaries dilate, blood starts to clot, chemicals are released that attract phagocytic cells. These are cells that eat up anything that needs to be eaten up, such as pathogens and cell debris. And if that's all resolved, if it happens really neatly, inflammation should calm down. And some of those chemicals that are involved in creating inflammation are called interleukins. They're a group of part of a group of chemicals called cytokines. So you may have heard of those instead. There are two interleukins in particular, interleukin